Hello everyone, my name is Elizabeth Ankrah and I am a third-year PhD student at the University of California, Irvine in the Department of Informatics. Today, on the behalf of my co-authors, I am very excited to be presenting on our paper titled When Worlds Collide, Boundary Management of Adolescent and Young Adult Childhood Cancer Survivors and Caregivers. Each year in the United States, it is estimated that over 15,000 children and adolescents between the ages of 0 to 19 are diagnosed with cancer. However, due to advancements in medicine, science, and technology, the overall survival rate of those diagnosed with cancer has greatly improved, especially among the childhood population, with nearly 85% of this population living at least 5 years after diagnosis. The cancer survivor population continues to grow, and cancer survivorship is the longest phase in the cancer care continuum, especially for the childhood cancer survivor. Thus, there is an important need to understand the experience of childhood cancer survivors during adolescence and young adulthood in order to support them. In this paper, we consider their experiences through the lens of boundary management. As an understanding of their boundary management leaves open opportunities to understand and design sociotechnical solutions. As such, we answer the following research questions. First, how do survivors manage boundaries across multiple contexts outside the clinic? And second, what are the opportunities for designing sociotechnical solutions to support survivors in managing these boundaries? To answer these questions in partnership with our local children's hospital, we've recruited and conducted 30 semi-structured interviews, 24 of which were with cancer survivors between the ages of 15 to 35, and 6 of their caregivers. For data analysis, we went through several iterations of coding. The first 2 authors began by conducting in vivo coding. Following this initial process, the coders independently asked reflective questions such as, what is going on here, prompting descriptive coding. Having independently developed their own codes, they met to discuss and combine their codes through affinity diagram activity. At the conclusion of these activities, coders developed a code book and went on to recode the rest of the data, creating memos along the way. Reoccurring themes that emerged at the end of this dealt with 3 boundaries that survivors manage. The first boundary we noticed are societal boundaries. Societal boundaries were encountered by the survivors or the caregivers as they navigated systems including the healthcare system, educational system, the employment, and other such systems. They often interacted with these systems in order to meet their everyday needs, including receiving accommodations needed to succeed in their educational pursuits, finding information and resources on how to get insurance or pay for medical bills. Sometimes it was not easy to manage these boundaries. For example, caregiver 3 said, "For the first time, I had somebody who understood what was going on and I didn't have to fight," referring to finally getting an IEP accommodation for their child. Next, another boundary that survivors had to manage included relational boundaries, which existed between the survivor and one or more people in their social network. For example, parents, teachers, and on social media. Participant 10 said, "You feel like for so long, you're like the focus of everyone's pity. I feel like we're a world apart, but I just want to feel like a little more like a high schooler." This demonstrates the challenges that exist between their expectations and others when interacting with their non-cancer peers. Finally, survivors and caregivers manage personal boundaries, which included expectations, beliefs, and worldviews that survivors had and used to navigate their survivor experience. For example, participant 13 said, "I am more than a cancer survivor and more than a cancer patient." Overall, survivors held different beliefs about what it meant to be a survivor. These boundaries supported them in defining themselves, creating a narrative about their experiences, and making decisions based on their values. Within the context of these boundaries, there are opportunities to design for sociotechnical solutions. First, addressing systemic issues that deal with societal boundaries. Researchers and designers can study how government agencies, clinics, or insurance companies relay information to survivors and design for more effective organization and communication practices when disseminating the information. Next, there's an important need to support the context of disclosure and privacy. Tools can be designed to help survivors keep track of where and what information are shared online publicly concerning their experience and request for its removal or approval of the data. Finally, design opportunities exist in supporting the growth of survivors through transitions. After treatment, survivors may seek opportunities to define, reconstruct, or come to terms with their experiences, values, and identities. As such, the management of personal boundaries involves responding to cancer not just as a medical condition, but as a traumatic event or life disruption. Therefore, understanding the survivor's experience through a trauma-informed lens may produce additional insights surrounding support for survivors. Thank you.